Kei ngā manukura, kei ngā manu taiko, tau mai rā ki te hui. Ko mihi ngā rangi tēnei e mihi atu nei kia koutou katoa. Welcome to the Hui, Māori current affairs for all New Zealanders. E taru ake nei. With the COVID-19 vaccine rollout underway, we reveal the results of a special poll. How many Māori are willing to get the jab?
Tino awanga ahau, tino mataku ahau.
And if not, why not?
There are trust issues between Māori in particular and government agencies, and we're going to have to combat that.
Our special panel discusses all the results. Kara hui hui mai. You're watching The Hui Live. Tonight we're discussing the rollout of Aotearoa's COVID-19 vaccine program and its uptake by Māori. I'm joined by Aotearoa CEO Stella Hart, immunologist Dr. Anthony Jordan, iwi advocate Honi Harawira, and from Wellington, Deputy Director General of Māori Health, John Whanga. Tēnā koutou. Well, soon we'll look at the results of our poll, but first let's hear from someone who isn't yet convinced about taking the vaccine. Kathleen Thomas loves to sing. She's a proud wahine from Pipiwai, but like many other Northlanders these days, she's based in Tāmaki Makaurau. And despite the city recently going into level 3 lockdown, Kathleen is still uncertain whether she'll take the COVID vaccination.
Hore kawe pai moa hau, nā te mea, hore mātou e whakaro, raha te mahi ki roto e rā rongoa, tino awanga hau, tino mataku hau. I don't think it's right for me, because I think we have enough crap coming into our bodies now. I just think we don't know enough to warrant us healthy people having it.
Where do you source your information about vaccination?
Well, I've just seen it on Pukamata.
Facebook?
I actually on the internet, on Google. I think that's for everybody. I think for myself, I think it's just me deciding that no, because I don't feel safe having it.
Funnily enough, Kathleen comes from the same rohe as the man tasked with overseeing the Māori vaccination rollout, Associate Minister of Health, Pēni Hinari.
In my own family, they're vaccine hesitant, but after having watched what they did on the weekend as the first ones rolled out, and they're asking more questions. Our challenge is to be there with the answers. So we know we've got a job ahead of us.
And to achieve this, the Minister is looking to the Māori community for help.
So we're on a hunt for more vaccinators, Māori vaccinators. And I think if we are able to get a strong Māori vaccination workforce who can reach out into these kinds of whānau and communities, I think we'll start a journey of engagement with them that'll bring more and more people on board.
You are a prolific user of Facebook and you're online all the time. Do you ever see any information from like Māori health organisations, Māori ministers, Māori MPs talking and trying to discuss them?
Well, I haven't. And I think that's what I mean. We need to know more, because I think it's a new thing. He mea tawhito, mō tātou katoa, he mea tawhito. Kore mātou e mōhio iaha ki roto tēnei ki tēnā, o tēnā mataku mātou.
There's concern that still not enough has been done to counter the vaccine misinformation that's been spreading online.
Over the next few weeks, you'll start seeing a very specific and clear campaign aimed at our whānau. And the first part of that campaign is about information. It's got to be led by champions and led by people such as Kaumatu and Kui o Ngā Marae.
Experts say we need to have a strong herd immunity to eliminate COVID. But if we've got Māori in great numbers or even small numbers who aren't going to have the COVID vaccine, how are we going to look after the team of 5 million?
Yeah, look, I think as a team of 5 million, it's our job and our responsibility to tackle that small cohort that are going to be hard to shift. Media, myself and my colleagues, the Māori caucus, Māori ministers and even the Prime Minister will acknowledge that we've all got a role to play in reaching out to that really hard cohort.
With Māori still experiencing worse health outcomes than Pākehā, the burning question is whether the Minister will guarantee Koroua and Kuia be first in line for the vaccine.
Yeah, that's certainly what the advice is that's being given to the Ministry of Health, so I'm going to say yes.
And the Minister admits it's going to be challenging to reach everyone around the motu.
Some of our whānau live in the far reaches of Aotearoa and we've got a logistical challenge to get the vaccine to them or get them to the vaccine. For example, if we take the vaccination up north into Te Kao, it's got to be cool stored, and the last time I checked in the Te Kao dairy, my auntie didn't have a large cool store plant, so we're going to have to work on that.
So there's still lots of challenges ahead. Perhaps the greatest is winning the trust of people like Kathleen, so the team of 5 million can achieve the 70% vaccination rate that experts believe will give us herd immunity. Now the Hui has commissioned a Horizon research poll sampling the views of more than 500 Māori. Kia tahuri ake tātou ki ngā tatau tuatahi. We asked our respondents how likely they were to take a COVID-19 vaccine. 65% said they would definitely or were likely to take a COVID-19 vaccine. 23% said they were unlikely to do so or definitely would not. And 12% said they were unsure. But when we look more closely at these numbers, they show that while only 40% say they definitely will take the vaccine, just 12% say they definitely wouldn't. And that means there is plenty of opportunity to get more Māori on board. Ka pai, 65-23, is this a good result, Sella? Or is this a worry?
Yeah, well, I think that it's absolutely a conversation starter. And I think that what we really need to be looking at is how we understand all of the mistrust that sits within our whānau and communities across hundreds of years. And then to put on top of that something that, you know, some of our whānau are a little bit, you know, hesitant about. I think that it's really encouraging to see that there is a good proportion of that data that's demonstrating that there is an appetite. And I also think that we need to keep our arms wide open for those whānau that might not be ready right now. And when the science and evidence hopefully comes through as fast as it possibly can, to allow them the opportunity to have that as well.
Ka pai. John, I'm going to come to you there because I want to pick up on what Sella talked about, the distrust, the mistrust of Māori. You know, when you look at the lack of access, the poor outcomes for Māori, 23% there are unlikely to take the vaccine at this stage. How are you going to, you know, reach out to those people and pull them over the line?
I think doing two things. One is making sure that everybody is aware of vaccine and vaccine information. Sorry, I've just got some feedback in my ear. But I think also making sure that people get the best information. It's really important also that we have our people championing the vaccination and also our communication channels and the channels that reach into our communities. These are things we're going to have to do in conjunction with our communities.
Cool. Ka pai, I'm going to come to you, Anthony, because inside of those stats, we understand now that wahine are not so keen to take the vaccine compared to men. Why do you think this might be?
We don't really understand it, but it is definitely something that comes through multiple times when we look at vaccine acceptance in that age group. There are a lot of issues for wahine that are young in terms of the effect if I got pregnant, for example, So they may be thinking beyond just protecting themselves and may look for more reassurance than there currently is.
Is it an issue for pregnant women?
Definitely it's an issue for pregnant women to be protected from COVID-19. I think it is wise and prudent to say what are the vaccine results in pregnant women, and those trials are going on now.
So what's your solution to protecting our wahine Māori who might be having a baby soon or a hapu at the moment and who might not feel comfortable to yet take that vaccine?
I think look for the evidence that's coming out around protecting wahine that are pregnant or may fall pregnant, and also it's our responsibility as those around those wahine to provide them with that korowai of protection by being vaccinated ourselves to protect them.
Ka pai korowai manaaki. Hone, 52% of those who are unsure, of that group, 78% of them are 18 to 24, and we often talk about not talking our rangatahi's language. You know, you come from the north where so many of your people are young.
Yeah.
How do we reach them?
Get the young people out talking to them, get them talking to one another. Lead out with people like Lance's boy, Connor, who's himself a doctor, and a lot of his friends who are involved in a whole range of different issues. There's no point us talking to them. But just have rangatahi talking to rangatahi, spread the message that way. That's important, but probably the big question I have would be for John. I mean, I really want to know, John, seeing as how we're doing our best to look after our old people, you know, if the border control is number one on the list and all the doctors and the health providers are next on the list, are our kaumatu and kuia the next on the list, given the kind of medical conditions that Māori face, which make this worse than it would be for anybody else in the country?
Yeah, so in the tape piece there, the Minister, Penny Henare, said if it was up to him, it would be yes. Yep. So I wonder if you might be able to answer that for Hone Harawira Pia, John.
For everybody, John?
Yeah.
Give us a yes.
Matua, are they going to be higher up the rollout list than others?
I think, as Minister Henare pointed out, it's certainly the advice we're getting is Māori are likely to be disproportionately affected. And also we have a range of other conditions with which COVID exacerbates. So certainly the advice we're getting is Māori in particular and Māori and Pacifica are peoples that are most vulnerable from COVID. And certainly as the government's looking at the moment, they're looking to address those most vulnerable first. So as the Minister, I support the Minister's position, and that's certainly the advice from a range of different experts, that we need to make sure that Māori and Pacifica are part of those vulnerable groups vaccinated early on in the campaign.
Tēnā koe. After the break, our poll looks at the reasons for and against vaccination among Māori. Kei te mātakitaki koutou I a te hui. Kia tahuri ake tātou ki ngā whika tuarua. For the cohort who said they would definitely or are likely to take the vaccine, we asked their reasons for doing so. The top four are 80% said to prevent COVID-19 spreading through the community, 79% said to help protect other New Zealanders, 76% said it's important to protect my whānau, 76% also said it's important to protect my health. For the cohort who said they would definitely not or are unlikely to take the vaccine, we asked their reasons for doing so. The top three are 52% said, I'm not sure yet that the COVID-19 vaccine is safe. 45% said it's too soon to see whether there are any long-term effects from the vaccine. 41% said, I don't think I know enough about the vaccine yet. Kia ora, John, I'm going to come straight to you down there in Wellington. You know, those who are not keen to take the vaccine have some pretty reasonable reasons for it. They want to know that it's safe. Can you answer that question?
Yeah, can I start by also turning some of these on their head, Mihi, to say, first of all, the majority of people are keen to take a vaccine. So I think we shouldn't lose sight of that because there's some momentum we can develop with them. I think when you look at the results you just read out, there's a large proportion of those who are unsure who want good information. And I think, to be honest, Mihi, there's a lot of rubbish on social media at the moment. There are two trusted sources of information, the COVID-19 website and the Ministry of Health website. And I think it's really about encouraging people to get information from trusted sources because, as your results have shown, if they get good information and they're able to understand it, it's highly likely they may decide to take the vaccine.
So, yeah, trusted sources, Director General Ashley Bloomfield, but not everyone has the opportunity to tune into the press conference at 1 o'clock every day. You know, some people, some of our whānau are literally just working hard to put kai on the table. So I guess how is the Ministry of Health reaching these cohorts of people?
I think as we move forward, we'll be utilising every channel available. We've got iwi and Māori channels, for instance, and radio and networks. We've got community groups. We've got our own champions. In fact, there are a large number of Māori leaders who are already identifying themselves and saying, we're happy to take a jab in front of the TV if that's going to help our people get vaccinated. So I think it's every channel possible, but I think we should start where we've got areas of strength. As I said, we've got 2/3 of the people who want to take the vaccine, and I think we shouldn't lose them from sight either.
Kapai. Sala, has the horse already bolted on some of the stuff that John's talking about?
I think that the Ministry have done a good enough job within the parameters, and obviously this is an evolving situation, so as fast as they're receiving information, they're trying to get it out the door. As a Māori provider who works out in our communities, and you know, notwithstanding I don't absolutely get to reach into every single home or community grouping, I think that there is some holes or some gaps that I suppose have been exposed, and I think that we need to really place the privilege and the opportunity with those providers that have the trusted sources of interaction and engagement with the community.
If funding had no limits, what would you do?
I think we need to ramp up our investment in our Māori community providers and all of those that have the grassroots connection. Many people, and we're working in a space of the digital divide where we need to actually come up with innovative solutions that don't just rely on the 1 o'clock presses, that there's a whole cohort of whānau and community that's not even on their radar. What
does that look like in your community, Hone?
Yeah, I think it's really just being positive, getting out there. Like, you know, I'm busy as, but if I had the opportunity, I'd get around to as many kaumātua and queer as possible. And I know I still have a lot of influence with them. And I'd say what I heard from a good friend of mine. He said, kore au kite te mano tangata I tā wāhi mate I te rongoa. Nō reira mena ka tāma I te rongoa ki taku kāinga, ka kāinga e au. I have not seen thousands of people dying from vaccinations, and yet they're dying from COVID. So if the vaccination comes to my home, I will take it. And that's the message. And particularly with our old people, that's a cohort that everybody wants to protect, and they understand because they are of that age group, the smallpox, the diphtheria, the TB, the everything, they understand what those things are. So I think we should focus really on protecting those, and they are the most vulnerable ones in our community. So let's look after them first. And I also say to other people, get our old people taken care of, and then after that, if you want to sit back and say, well, it's not for me, well, that's your choice. But protect the ones that need to be protected, our old people and our kids.
The Prime Minister today announced Pfizer's going to be the vaccine of New Zealand's choice, 8.5 million vaccines that we've ordered. What happens? Oh, well, there was a suggestion today that the other vaccines may go to the Pacific. Is that a good idea?
Definitely. I think we only need to remember the measles when it went to Samoa. Yeah. What happens when we don't think about our Pacific community?
Deaths.
Exactly. And, you know, that burden sort of rests on our shoulders, and we won't forget that. And I think the government have thought about that in their pre-purchase agreements about those type of vaccines, how they could work for the Pacific.
Just quickly, the Pfizer vaccine, in your opinion, as an immunologist, is a good one?
Definitely, I think so. I think there's data now from the rollout in Israel that takes it beyond just the clinical trials to real-world evidence that shows we vaccinate 500,000 people, we don't vaccinate 500,000 people, here's what happens, here's the safety. A lot of people were vaccinated, so those people that said, I just don't know if it's safe yet, that's a lot of people to be able to detect if something's going wrong.
Will it be free?
Yes, and I think that that's one of the key things that we need to make sure. If we don't want to increase inequities for our whānau, access points need to be free. We need to understand what that means for rural communities, and we need to make sure that it is available.
Is it 1 or 2 jabs?
2.
Ka pai. Next, we find out how much trust Māori have in the government to roll out a safe vaccine for all. Auraki mai anō, kia tahuria ki tātou ki ngā whika whakamutunga. We asked all respondents how much do they trust the government to make sure a safe vaccine is available to everyone. 67% said they trust the government, 18% said they distrust the government, and 11% said they neither trust or distrust, and 4% said they didn't know. We also asked what would make them more likely to take a COVID-19 vaccine. The top 4 responses. 51% said evidence the vaccine offered is unlikely to cause a serious adverse reaction. 39% said more information on possible side effects. 38% said if the vaccine's free, and 35% said if MedSafe has approved the vaccine for use in New Zealand. Kia ora, John, I'll come to you. I just want to pick up on whether the vaccine is truly free. Sally says the vaccine's free, but can you guarantee that, the jab, the consultation and the follow-ups are free as well?
That's my understanding, Mihi, is that, yes, the vaccination campaign will be free.
Is it your understanding, or do you actually know, because what we know sometimes with access with our people is that, the GP will charge them even though they're not meant to? Like, how are you going to make this clear, because you're going to have people who won't go?
I think we'll be making that very clear to the people who are doing the vaccinating, and we'll also be making it very clear to people as we roll out the campaign about how they access and also that the vaccination is free.
Kapai, why is it important? Will people miss out? Will there be queue jumpers?
Yeah, I think that's a really good discussion point, because what we know is that there is the cohort of whānau who are the worried well. And by that I mean the worried well that might be sitting around this table. I think that what, being really honest, is that there will be people that have more resource or more capability or ability to access the things that they need in their time of need. And I think that what we need to ensure throughout all of this process is that no one is put behind anyone else, and that there is a prioritisation, as Hone talked about previously, keeping our koe and kaumātua safe and well, and everything that we can do to support that is going to be really, really meaningful.
Earlier, John Whanga in Wellington talked about how he had people who were nominating themselves to front videos or social media campaigns, but what we're hearing from our people is, and this is a Māori specific poll, don't get us wrong, is that church leaders, iwi leaders, politicians and famous sports stars are not who people putting their trust in. They want to hear from medical experts. Do you think that resonates in your community too?
Oh, I'd hope so, but I think that, they just want to see people of importance in their little community. It doesn't matter whether it's in Te Kau or Paorenga or Morewa or wherever. They just want to know that the leaders of their community are saying so, and that they have that information, that evidence that, it's not going to make me fall over, it's not going to cause me to have 2 hands, all that kind of stuff, that it's as safe as it possibly can be. I mean, the message that we had from border control is shut the gate. And it's the next stage. If you can't shut the gate, then vaccinate.
Let's ask you, Anthony, that is a question, how safe is it? Are there adverse reactions? What do you know?
So we have good data, so if we keep on the Pfizer vaccine, because that's the one that's obviously going to be the one we roll out, the thing that people most worry about is serious allergic reactions. And we have good data now that about 11 per million people will have a serious allergic reaction. So that's very small numbers. And as an allergist, I can tell you, those are things we can treat. I think what we have is a sort of a remnant of past bad stories about vaccinations that were proven to be untrue, that make people worried about long-term outcomes. And we're still dealing with that today in terms of saying that was false, that was made up. But how do you backtrack on that? You can tell people evidence, but a story is sometimes very well implanted. And
you did have some new numbers on the inequity of COVID impact on Māori Pacifica versus non. What were those?
So there's been quite a lot of modelling done to look at both the conditions that are overrepresented in Māori and Pacifica. These are diabetes, 5 times the risk in Pacifica, cardiovascular disease 2 to 3 times more likely amongst Māori, and those 2 conditions alone increase your likelihood of dying from COVID-19. And there's a really, cool for nerds, modelling data that looks if you're an 80-year-old European person, that's equivalent to being a 55 or 59-year-old Māori Pacifica in terms of what that risk is of having a bad outcome in terms of being hospitalised with COVID-19.
So I guess what does that look like in your communities?
Yeah, I think that what we need to be really, really understanding is how do we apply all layers of protection for our whānau, full stop. Hone was great. He did some amazing border control up in the north, as did many others, and our iwi stood up. Our iwi responded in a time where there was no other response happening, and I think that this is just another one of those phases. We're going through a phase of understanding, first and foremost, what is going to keep our babies safe, what are going to keep our koe and kaumātua safe. What can we do to contribute to that?
I guess when listening to those numbers there, you know, 80-year-old European man versus a 59-year-old Māori or Pacifica person, when you consider the health agencies' availability in the north, I mean, does it give you any confidence?
Hence my asking John and Penny and whoever the minister is and everybody else. I want to make sure that, you know, doctors, border control are right behind them, our kaumātua and koe Māori and Pacifica, and those of our whānau who suffer from ill health, because, you know, we deserve to be at the front of this queue. We're normally at the front of the queue, which is getting chucked out of jobs and all that kind of stuff, going to jail and all of that. But this is one where we deserve to be at the front, and it's our job to do as much as possible to ensure that our old people are, our sick people are, our babies are. And if we can do that, then we will have done a job for the whole of our community.
He pai te wānanga tēnā koutou katoa Aotearoa kia koe hoki John in Wellington, ka nui te mihi kia koutou katoa ko hikina te hui mō tēnei wiki pai mariri kia tātou katoa. The Hui is made with support from New Zealand On Air.